Hello and welcome back to another episode of Medicine in Small Doses with Dr. Amobi. I'm your host, Uju, and today we are beginning a 4-part series in honour of Men's Health Month. Men's Health Month runs from the 1st through the 30th of November each year. And today's topic significantly affects a number of men, especially men within the Black community. Today we are talking about erectile dysfunction. In this first part, we are going to be talking about how men present in their consultations with their doctor. So Dr. Amobi will be going through that. And it's not to make light of the situation. It is to see if it resonates in any way with you or can offer help to someone you may know. Part 2 is from another perspective. We're going to be looking at it from the viewpoint of the partner, the wife, who has come to see the doctor on behalf of their partner or husband who may be experiencing erectile dysfunction, and really to find out what they can do to help or how they can encourage their partner to see the doctor themselves. Part 3, we're going to have the man that has come in, made that significant step to see the doctor about a very real issue and what they can expect from their GP appointment. And the last part, Dr. Amobi will be going through how you, the listener, can improve symptoms of erectile dysfunction so that you can enjoy a life of vigor and vitality, which is what we stand for here at the Lifestyle Wellness Clinic. So without further delay, let us get into it. Dr. Amobi, hi, and welcome to another episode.
Thank you. It's a pleasure being here. We're talking about something super important in men's health. You know, in my estimation, one of the most important things to talk about. So I'm happy for us to dialogue, and I hope listeners, you guys find this very useful. I know it's a very touchy subject, and we will try to be as sensitive as we can. But the overall aim here is to provide valuable information, because back in the days, we used to see men age 40s and 50s in their first presentation of erectile dysfunction. But these days, we are seeing men as young as 20 years old. So it's vital that we talk about erectile dysfunction in this instance, particularly in Men's Health Awareness Month.
Of course.
Yeah.
Seems like the situation is getting desperate. And as you've mentioned, or we said at the top of the episode, Black men are being affected by this on a large scale. So before we get into it then, Doctor, can you clarify what is erectile dysfunction?
So erectile dysfunction has 3 parameters. Number 1 is men's inability to get an erection. 2 is you need to have erection that you're able to maintain through intercourse. And 3 is you would have to achieve what your definition of satisfactory outcome is, right? So that's in a nutshell exactly what erectile dysfunction means.
Okay. And what would cause a man to fall into the category of erectile dysfunction?
So if you break it down into physical health, psychological health, and social health. So from a social health perspective, you're looking at things like the stigma attached to erectile dysfunction. Those are things that would make men, may affect the erection, ability to get an erection. Psychological health, stress. It's so difficult for you to see somebody who's stressed out or somebody who's depressed or get anxiety, and the first thing that comes out is an erection. It just doesn't work that way. When it comes to physical health, example of physical health is things like diabetes, high blood pressure, heart disease, stroke, prostate diseases, and things like that. And if you look at all these parameters, you would see that we as Black men rank number 1 within the social issues, because of course that goes without saying. Then you look at psychological issues. We are 4 times more likely to have mental health disease. We are 4 times more likely to have anxiety. Then when you come to physical health, we rank number 1 in prostate disease. We rank number 1 in blood pressure. We're ranked number one in diabetes. So all of those things have significant impact on black men, let's say. And one of the things you might notice is that most studies that looked at erectile dysfunction tend not to focus on black men a lot. And I think that's one of the reasons why we said, look, I know it's a very sensitive topic to talk about, but it's very important that we bring a shine to it. Yes.
Okay, great. So let's get into the 5 ways that men have presented in your clinic with this issue.
Right. So this is the interesting part. I think I'll prefix this by saying that we're biologically wired to fix things, right? So we are less likely in general to visit doctors. We tend to have this like fix it or forget it approach when it comes to our health. The only time a man goes to see a doctor is like when that problem becomes so significant that they can't manage it at all. So the number one reason, I think, I would rank number one is men who will come to clinic and say, my wife sent me.
I actually read something about that recently to say that in a heterosexual couple relationship, it's usually the women who are encouraging their men, going to the doctor, have you seen the doctor, and even booking their appointments. So actually, I'm not quite surprised that you said that.
Yeah, no, in my estimation, I think that without black women or without women in general, most men would be dead. Right? No, honestly. And this goes beyond erectile dysfunction. Almost every other man that comes in my clinic goes, my wife is worried about X, right? And then that's the reason. And for most of them, they would have showed up when he's become like very contentious at home, and then they decide to just rock up to the doctor, and they wouldn't be taking it as serious as their wives or their partners are. So
we're going to get into that more in the second part anyway. So sure. That's good. Okay. So let's continue.
So number one is my wife asked me to come.
Right.
Now, it's quite interesting because I always ask these men, like, if your wife is worried about the erection, why are you not worried?
Yeah.
Right? And then they will come up with like a lot of, I've been a bit stressed at work. And some of these things are legitimate reasons, etc. But the driving force, number one, is the wife asked them to come, to go and see the doctor.
Yeah.
So I would say number two is men are very funny. I would see men in clinical practice who will show up to talk about erectile dysfunction, but they start talking about something entirely different, right? So the sole purpose of seeing me today is to talk about ED, but they'll start with headache, or they'll say something like, my eyes are twitching at night, or my feet are hurting. Is there any blood test that I can run to find out what may be causing this problem, right? So, and then you will say to them, okay, cool. They go, can I just get a general MOT then? I would say to them, what type of MOT do you want? So we can run like basic blood tests, or we can do something a bit more specific. Now, if you're a doctor worth your salt in clinical practice, whenever men coming a bit dodgy, something dodgy is going on, right? So you have to put your antenna up, and don't let them leave. Because if you're a doctor or a clinician or anybody listening to this, my style of doing it is usually, I'll say, look, we run routine blood tests, which check your blood count, etc. But there are some specific tests I always do on men, things like prostate, things like testosterone, things like your thyroid functions and things like that. The reason I do that is to see if I can find some of the conditions that men are less likely to present with, things like erectile dysfunction. I will guarantee you 99% of them, once you mention erectile dysfunction, their eyes will lit up like as if you just read their mind. They go, can I get one of those? You go, which one? And they wouldn't even say the erectile dysfunction. They would say like the last one you mentioned.
Right,
you know what I mean? So they wouldn't say, can I get a blood test for the erectile dysfunction? It's like, can I get one for the last one that you mentioned? And then they will start asking you some questions like, is it not for men who are older that experience this sort of problem? Would you expect that in a 30-year-old, right?
Okay,
and
so
that's your little cue or roundabout way, and like asking you, why am I getting it at 30?
Right.
So that's there's a very interesting dynamics in clinical practice. My third one is, I call it the knob rub consultation, and please don't take this the offensive way. The reason is, I think the doorknob in my clinic, in my consultation room, has some magic power, right? So this man, for those ones who didn't actually like take the bait when he said like I do erectile dysfunction tests, etc., right? And they've perhaps exhausted their consultation without mentioning anything at all about erectile dysfunction, and they don't want to talk about it. They just want a pill.
Right.
So what they'll do is, once they hit that door, and of course they know that once they walk out of that place, that's it.
Probably went home to the wife that said, "Did you get?"
You're right.
That's probably one thing.
Exactly. Yeah. So what would happen as soon as they touch that?
Can you give an example, like role play out? Or?
Yeah. So I would get something like, as soon as they get to the door, they hit the knob rub. They go like, they hit the knob and then they turn it. They go, "Oh, I'm sorry, doctor. If it was black men are the coolest, man. They would go, bro. Can I ask you something? Yeah, my wife asked me to get like one of those pills. What is it called again? Viraga, the blue pill. Yeah. Can I get one of them on prescription? That saves me like running around chemist and going to buy it. And I was like, so you mean like now? Before I even go there, even though they've exhausted their consultation time, I know that if I let them walk through that door, that man is never coming back there ever again.
But it's a whole new consultation.
But it's just a brand new whole consultation. But I'm quite happy to run late to catch them, because, and this goes for every man. It doesn't matter white or black or Asian.
Yeah.
But particularly brothers. I'll go, okay, cool. Have a seat. I'm going to check your blood pressure, because I use it as an educational moment. I go, I'm going to check your blood pressure, because sometimes blood pressure can actually be a cause of this thing that you asked me for the pill for. So then I will go into the health issue through that way, right? So that will be like the third way they will show up. And then the fourth is they will come, this is probably a bit more on the younger men. They will say something like, let's say a guy 25 or 30 show up in clinic, and they establish some good rapport with you, and then they come up with something like, bruv, anytime a brother comes in clinic and call me bruv, I know something is up. Yeah, so they'll go, bruv, you know what, yeah, my cousin, yeah, we were just talking last night, and he was saying to me like he's got problem with like getting it up. And he was like dating this bird, yeah, and a really nice guy, and he doesn't want to mess the relationship up. But the problem, he can't even get it up. What's that about? And then you go like, they go. So again, everybody else say the same thing. I thought this was a problem for like old people. Why is he getting it? So he's a bit worried. Of course, he's telling you that it's him, right? Now, how do you make sure that you take him seriously? I said, look, I'm going to teach you everything you need to know about erectile dysfunction. It's up to you if you don't want to teach your cousin, but I'm going to talk to you as if it was you.
Yeah.
They go, all right then, right? And then you go in, and then you have a chat, etc., right? Sometimes you get people who come in with a bit more slightly dodgy questions like, bro, you know something about erectile dysfunction, yeah? Is it genetical? Yeah, so because of course, as black people, we have the proclivity to, blame most of the diseases that we encounter, as a genetic predisposition, right? Yeah, things like diabetes. Yeah, I'll diagnose somebody with diabetes in my clinic, and they'll say, "Oh, I'm not surprised because my dad had it and my grandma had it, etc., right?" So there's always that it's not my fault thing. It's I just inherited it.
It is what it is.
It is what it is. So the genetical ones is I've got quite a lot of the geneticals. Now another thing I see in clinical practice, and this may be very funny, well, not so much. Most women, as we said earlier, that without most men will be dead. Most men don't even know what pills that they're taking. Right? So I would see women from every other race that normally come to clinic to do a refill of their husband or partner's medications, right? I would say the only race of women that I don't see in clinic requesting for their partner's Viagra or black women.
Right.
Do you know why?
Yeah.
Because brothers don't want their wives to know.
Right.
You know, so again, it's the stigma, you know, to some capacity, and of course the way we process things. So some of them would. So I had this gentleman in my clinic. He would come in to do his medications, and then his wife would say like, "Hello, doctor, we need all the pills. I think there's some he has at home, the other ones he doesn't have." And then these men will lean over my screen and they go, "I want this one and that, I want that one. Don't print this." So they use their hand and crush on the Viagra part because they don't want their partners to know that they're on Viagra.
Okay.
Right? So, and the wife would be like, "You don't even know what you're taking. So how do you know what's left or what's not?" But he didn't want her to know, right? And I always find that very intriguing, like why black men can't just say to their partners, like, "I'm on Viagra." A lot of them are on it, but it's my patient, you know what I mean? So the patient was like, the wife is saying something like, "Doctor, what tablet is he talking about?" I was like, "Sorry, you tell her."
Yeah.
You know, because you can't breach
Stigma
confidentiality.
is a huge thing.
Is a huge thing, right?
Mm.
So I think the summary of it is most men who will come in are totally terrified of having that conversation. And the bottom line today is, for most men, they think that other men don't go to consultations or they don't talk about it within their friends group or hear from any other man, right? My advice is go and see your doctor.
You're not alone.
You are not alone, number one. Number two is a lot of men are actually coming forward. I would say in the last 5 years, I have seen more men coming in with erectile dysfunction than ever. Of course, we don't tell our best friend that we're going to have a chat about it. So if you think your best friend is not going to see a doctor about erectile dysfunction, think again. They're going to get their problem sorted out, you know, and this is something we treat like in confidence, you know, give it the right medicines. But the single most important takeaway that I want you to take away from this episode is that erectile dysfunction is not just a problem about you having, satisfactory sexual intercourse. It's implicated in heart disease. Right. As a matter of fact, it's the earliest warning sign of a potential heart attack even before you have a chest pain. So please do not delay, because the risk of heart disease is way significant in our community. So if that happens, have a chat and your expectation. And we're going to talk about this in the future episode about how to see your doctor and what you would expect from your doctor. Does that make sense?
It makes perfect sense. Okay, before we conclude, I want to shine a light on the 5 different examples that you illustrated in this episode of the men that present in your clinic. I just want to, applaud them for making what is a difficult journey. Yeah. Especially based on what you said. So
absolutely. I think and that's a very, generous way of looking at it, because, in my estimation, and I'm a man, I applaud all these men who actually have the confidence to show up. The fact that they left their homes to come to clinic, and whatever that made them change their mind, right? So if you look at the first one, is somebody who is either hiding behind their wife or actually know deep down there's a problem, but they want to soften the quote unquote blow, and again maintain their masculinity. So they're presenting that way. And then the second and the third example I gave were more of like people within the denial domain, but they still strived somehow to give you the bait. What I will advise exactly, and the difficulty with this is if you're already exhausted like your consultation time, and then they give you that bait, please be careful, because not all clinicians will be able to. Not they shouldn't, but the issue is if your time is up, and then they probably say to you, "Look, come back another time."
Book another appointment.
Most men may not show up. That's one of the reasons why I usually go that extra mile to say, just in case he doesn't come back, right?
And then valuable time is.
And the valuable time, because if they don't show up, let's say for example you say to them, "Come back," and they didn't show up. These are the people that you see 3 years later, they have a heart attack. And like I said earlier, not all erectile dysfunction is going to lead to a heart attack. I'm just basically saying that from those ones that have biological causes, physical causes, or health-related causes, those are the ones that are actually lead to a lot of problems, right? So whatever that causes it will invariably cause a lot of problem, either in your social life, in your psychological health, in your physical health. So the moral of this, the story today is go and see your doctor. And if you're struggling, even there's another way, do the online consultation. Write it. If you don't want to talk about it, write it and then send it to the email through the online consultation to your GP. They will read it and then they will be able to consult you properly.
Excellent. Yeah? All right. Well,
Brilliant.
That concludes another episode of Medicine in Small Doses with Dr. Amobi. For all our listeners out there who want to connect with Dr. Amobi, the best way to do that is on LinkedIn at Dr. Amobi. Dr. Amobi is the Chief Medical Officer of 3 clinics. To find out more about the services he provides and how they can help you, please contact him through his team via the following websites: passporthealthuk.com, mymenopausegp.com, and the lifestylewellnessclinic.com. You can also follow Medicine in Small Doses on Instagram at Medicine in Small Doses. We look forward to you joining us on future episodes, and I want to thank you personally for listening.